So, good morning, everybody. We're here to talk about the recent decision from the Department of Health and Social Care about people being double jabbed in primary care by the 1st of April 2022. Welcome to Joe, especially Joe Herzog from Abrahams Dresden, who's our litigation and employment lawyer. So he'll be able to help us through any bumps in the road while we're discussing the legalities of it all.
The quagmire of legalities, some would argue.
Yes. So look, actually, I'm going to come to you first, because what do you envisage the impact will be on valuations of dental practices?
Well, I think the impact on valuation of dental practices is largely going to be similar to what I imagine Lisa's going to say in terms of the impact on recruitment, because put simply, there will be a number of people who will leave the dental profession as a result of this, because they don't want to be double jabbed, in much the same way that last week a number of people left the care profession. And given the fact that we're already in a position where there is, if you like, a bit of a recruitment crisis, not just for dentists, but for ancillary support staff, for sort of dental nurses in particular, is that if you take away another chunk of that workforce, then inevitably the workforce that is left under the basics of a supply and demand curve are going to probably require more money, as there's less of them. And where you then have a dental nurse which costs an extra £1,000 a year, if you're then selling your dental practice at, say, a multiple of, say, 8 times EBITDA, then that's £8,000 off the valuation. And if you then multiply that by, say, 10 staff in a practice, then quite quickly the numbers add up and can have, a relatively dramatic impact.
So it could have quite a big impact then on valuations. And Lisa, what do you envisage being your main problem when recruiting?
Yeah, so just following on from Luke, because I think, Luke, you make a really good point there with regards to dental nurses. One of the trends that we've seen throughout the pandemic is there are a lot of nurses leaving the industry. Now, that is for a variety of different reasons, but one of the main ones being obviously the hourly rate, sort of for what they're doing. They're coming into contact with people on a day-to-day basis. You put COVID in there and, they're looking for more money ultimately, and they know they can leave the industry and go into retail, for example, on a higher hourly rate. And I think when you put into the equation the need for them to then be double jabbed, that is going to have an impact. They're going to think, well, actually, I don't need to be double jabbed to work wherever, so I'm just going to leave. I've got a higher hourly rate. So that is one of the things. And I think that may also apply to other dental staff, of course, as well, but specifically for dental nurses. In addition to that, you've also got the compliance side of things. So, I deal a lot with locum dentists. How a practice is going to expect for their vaccination status to be shown? Is it going to be in the form of a COVID pass? So there's lots, I think, for us to consider and to take on board ultimately moving forwards.
Indeed. And Joe, we were talking, there's quite a few people who don't like to, they think it's an infringement of their privacy if they're asked if they've had the COVID jab. And leading up to the 3rd of February, I think, when the first one has to be done by, employers will need to know then to get an idea of which members of their staff have been had their first jab in time to get the one on the 1st of April. So, I mean, are you expecting people to be allowed to ask people those questions? And what if somebody cited, for instance, if they lost their job through it? How would you deal with that? Would they have a case of infringement of their privacy?
Yeah, sure. That's a good question. I think ultimately there's a few things that employers need to in healthcare need to sort of work out. I think the first one possibly is who is it going to apply to? We don't obviously have the regulations yet, but the announcement from the government says it's going to be people working in CQC regulated jobs whose job involves patient face-to-face contact.
So arguably that would include receptionists as well, Joe, wouldn't it? Wouldn't necessarily just be the nurses. It could include your reception team as well.
I think it will, and in fact, the government announcement specifically does refer to receptionists. People who they're not necessarily dealing with patients all the time, but as part of their role, they will have face-to-face contact. So ultimately, all those people who fall into that category, they will need to be double jabbed by the 1st of April. And I think then, so going on to sort of the question that you're asking ultimately is, can employers ask? Well, yes is the short answer. And in fact, I mean, although we'll have to wait to see what the regulations say, my expectation will be that there'll be an obligation in a similar way to the care home sector regulations. There'll be an obligation on an employer not to allow anyone to work in the practice if that person has not provided evidence of their vaccination status. So obviously, you know, in order for the employer to perform that duty, they will need to know and ask their employees what their vaccination status is. There is perhaps an issue about when they can ask that, because obviously the requirement won't take effect until 1st of April next year. But I think it will be legitimate for an employer who will, you know, need to start making their own internal arrangements, you know, for who's going to be able to actually work in the practice as of the 1st of April next year, to find out from their employees, you know, are they actually vaccinated or not. So I think the short answer is yes, you will be able to ask. Obviously, you'll have to process any data relating to employees' vaccination status, you know, in accordance with your sort of obligations under GDPR, but you will be able to ask the question, I think.
And what about?
Sorry, Lou. I was just going to add. I was reading it at the weekend, because it's like it's considered a health and safety risk, and under that banner, you know, you are trying to eliminate a risk at work. So therefore, that would be another reason that you could ask that question.
Yes, certainly, but I think ultimately it does really come down to, you know, the employer is under. I mean, you know, you can almost put aside to one side the health and safety aspects of it, and you know, because employers all have their own approach to you know, to what their staff, whether they require their staff to be vaccinated or whether they require their staff to come into the office or not. But you know, the simple fact is that, you know, as of the 1st of April next year, employers will be under this duty not to allow unvaccinated staff, you know, to work, and that will be a fair reason for dismissing those staff who aren't vaccinated at that point. And so.
And you speak about dismissal there, Joe. How, you know, this wouldn't be a gross misconduct thing, would it? So how would it actually work? What would the process of dismissal be? Are we talking redundancy? But I don't understand how it really falls into that piece of law either.
Sure, it wouldn't be redundancy, and as you say, it's definitely not gross misconduct. I think it's very unlikely to be misconduct at all. I think the reason for dismissal, and obviously, if you're an employer and your employee has got 2 years service, in broad terms, you need to have a fair reason for dismissing them. But the fair reason for dismissal will be the fact that it's illegal for that employee to work in that position. Now, clearly, I mean, it's a bit similar to sort of you know, a dentist who's you know, been struck off the register. Clearly, that does raise the question of, well, are there any other jobs that employee could do in the practice? You know, and obviously that's something that some practice owners may want to consider, particularly if they think they have got, you know, they are able to deploy staff in non-patient facing roles. But I suspect that for the majority of practices, or the vast majority of practices, there probably won't be. But, yeah.
So I suppose I've got two questions kind of going slightly different ways in this. So say you've got two people in the practice who are not going to get jabbed, and you then say, well, I've got one role that I could potentially have as a decontamination nurse, but in theory you've got two candidates. Does it then almost become like a selection process where you'd interview and then decide which one would get dismissed?
Yes, I think essentially it would be. So in that sense, you might adopt similar procedure to a redundancy exercise, where you sort of consult with staff and you know, tell them what the risk is here, and then you sort of assess their ability and skills as employees to fulfill that role and select between one of them. But I suppose the real question for the employer is there a genuine, you know, role for somebody to work in the decontamination room 100% of their time, or is it, you know, potentially something that they want everybody to have a go at, you know, one day a week, in which case, you know, that probably means that in this example, one unvaccinated employee two unvaccinated employees both might have to be made redundant. Well, sorry, not made redundant, but dismissed.
And with dismissal, we spoke about before, it would be a summary dismissal, which means technically it would be dismissal with notice, wouldn't it? So someone who actually has been with the business longer than, say, 8 years, and thus requires longer than 8 weeks notice, actually to be gone by the 1st of April, if you don't want to pay payment in lieu of notice, the process needs to be started slightly earlier. Is that right?
I think it is. Well, I think it does, rather, because I think if as the employer, it's not going to be very satisfactory to be to get to the 31st of March next year, and your employee says, yeah, I'm not. By the way, I'm not going to be vaccinated, and then you have to say, all right, well, I'm going to give you 8 years, so 8 weeks notice, or a payment in lieu of 8 weeks notice, or even up to 12, you know, for employees who've been there for longer. And clearly, it's not going to be particularly satisfactory to do that on the 31st of March because. Well, ultimately,
sorry, Joe, couldn't you start that process sort of around the 3rd of February? Because if they haven't had their first one, they're not going to get the 2 in anyway by then.
You may even decide that you want to start it even slightly earlier, and I think an employer would have a reasonable argument to say, well, to an employee, say that's on a 3-month or 12-week notice period. Actually, I'm going to give you notice perhaps 3 months earlier than the 1st of April. I think there is a bit of risk there because this grace period that the government is going to implement now is really to allow employers to have those conversations with staff, to allow them to get the right advice, and to encourage them to get vaccinated. But perhaps with an employee who's made it very, very clear that they have no intention whatsoever of being vaccinated, whether by the 1st of April or at all, it might be safer for an employer at that point to say, well, actually, I need to, you know, I need to arrange my business so that I've got cover as of the 1st of April. You specifically told me, you know, you're not going to get vaccinated. We've had plenty of conversations about it. Regrettably, I'm going to have to give you your notice, you know, earlier than that. And yes, obviously, it does save the employer some notice pay.
Yeah, I mean, I think we're going to have to wrap it up there. That was a very quick conversation this morning, but I think what we can take from it is, you know, the uptake is going to be increased, I think, by persuasion rather than punishment at the end if people haven't had it. So I think as employers, we have a right, you know, well, a duty to our employees to sort of try and persuade them and do anything we can in the workplace to persuade them to have that, you know, whatever their fears are, before that happens, because we don't want people losing their jobs,
no.
You know, if we can prevent it.
Absolutely so, right. Absolutely right.
Thank you very much all for joining us and discussing that this morning. And I'm afraid we'll have to call it a day there.